Welcome to the St. Anselm College Sports Medicine Yearly Compliance Information, an NCAA requirement. Our sports medicine staff consists of Head Athletic Trainer Mike Searway, Assistant Athletic Trainers Alyssa Van Patten, Zach Casanelli, and Amber LeBlanc. We work with New Hampshire Orthopedic Center, Dr. James Valis, the team orthopedic surgeon, and Scott Evans, the team PA. The current Title IX coordinator is Drew Litz. He is also the Associate Dean of Students for Community Standards. St. Anselm College strives to create an environment in which the dignity and worth of all individuals are respected. Please contact him with any questions or concerns. This video will cover COVID-19 and the changes in our athletic training room, along with educational materials on concussions, nutrition, hydration, mental health, cardiac health, drug testing, and sickle cell education. A reminder that COVID-19 or coronavirus is spread through respiratory droplets and can be very contagious. So although we're back on campus, it is important to wear a mask, stay physically distant, and report any symptoms immediately. Regarding the athletic training room, there will be access by appointment, no walk-ins. You will be able to schedule your appointment online through your ATS profile that you used for your yearly paperwork. They will be in half-hour appointment times, and our athletic trainers will be spread out throughout our different training rooms in order to keep numbers and exposure risk down. You will be required to fill out daily symptom questionnaires and temperature checks. Reminder emails will be sent nightly to be filled out every morning through your ATS profile. Temperature checks will be mandatory daily before entering the training room, your strength and conditioning room, and sessions and practices. A concussion is a mild traumatic brain injury from contact to the head or another hit that transmits force to the head. If you are experiencing concussive symptoms, you may feel headache, fatigue, dizziness or lightheadedness, feeling unsteady on your feet, nausea or vomiting, double or blurred vision, sensitivity to light or noise, feeling sluggish or slowed down, fogginess, or problems concentrating or remembering. Some signs that others may see in a suspected concussed athlete: they appear dazed or stunned, they're confused, they're forgetful about events prior to or after trauma, they have balance problems, personality changes, they respond slowly to questions, and a loss of consciousness of any duration. If you are experiencing any of these symptoms, please report them to your athletic trainer immediately. Don't hide your symptoms. If you do and you continue to play, you increase your risk of severe life-threatening injuries like second impact syndrome. Know that it takes time to recover, and we're here to help. In order to best evaluate a concussion, everyone must undergo baseline testing as an incoming student. This includes the BEST balance test, an in-person SCAT-5 test, and the computerized impact test. New this year, everyone will get a SCAT-5 baseline yearly. These will all be repeated if a concussion is suspected. Once you've been diagnosed with a concussion, you will follow up daily with your athletic trainer regarding your symptoms and progression. You will have a return to learn protocol with help from health services for academic accommodations. Once you no longer have symptoms and are good to return to play, you will go through our protocol, progressing from light daily activities to light aerobic activities like the bike, to sport-specific training, non-contact training skills, to full contact training after medical clearance by our team doctors. Nutrition is very important for athletes to help build and maintain strength, to keep their bodies properly fueled and hydrated, and to allow their bodies to recover efficiently throughout the entire season. To optimize training and performance, you must ensure you are consuming enough calories to offset energy expenditure. Eating disorders in athletes is characterized by a wide spectrum of behaviors and attitudes, including extreme concerns about body weight and shape, poor nutrition, binge eating, use of laxative diuretics or diet pills, and extreme weight control methods such as fasting, vomiting, and excessive exercise. The likelihood of athletes to eating disorders is a serious concern because of increased demands imposed by high intensity and high volume sport training. Approximately 62% of female athletes and 33% of male athletes experience this. If you or someone you know is experiencing disordered eating, please contact us for help. In addition to nutrition, let's talk about hydration. You should consume water throughout the day, not just when you're thirsty. So divide your weight in half, that is how many ounces of water you should be consuming in a normal day, and add more to that with working out. In general, about 20 ounces of water should be replaced for each pound lost during exercise. If you have any questions regarding refueling or nutrition, please feel free to ask us. We are also paired with a nutritionist for more in-depth conversations. The NCAA bans the following classes of drugs: stimulants, anabolic agents, peptide hormones, diuretics or masking agents, anti-estrogens, beta-2 agonists, and street drugs, although there is no complete list of banned substances, so contact your trainer to make sure that what you're taking is okay. In the event of drug testing, the sports medicine staff will be notified no earlier than 2 days before the day of testing. All selected athletes will be notified in person and giving their testing site and time. You must report at the designated time with a photo ID to provide a sample, and you must stay until an adequate sample is provided. A positive test will affect your eligibility, and you will not be able to participate effective immediately. If in the postseason, it can affect your team's place of finish. A failure to show at your designated testing time or tampering with your sample results in a positive test. Nutritional and dietary supplements are not well regulated and may cause a positive drug test. Many are contaminated with banned drugs not listed on their label, and any product containing a dietary supplement ingredient is taken at your own risk. So before consuming any product, review it and its label with your trainer. CBD, in any of its forms, may contain ingredients that will give a positive result. If you are taking this medication to help for a specific reason, whether it be illness, pain, sleep, mental health, or whatever, there may be better ways that are medically acceptable to help. So reach out to your primary doctor or ask us. The use of tobacco is banned during practice and competition for coaches, athletics personnel, and game management. The NCAA recognizes that some banned substances are used for legitimate medical purposes. Exceptions are made for athletes with a documented medical history demonstrating the needs for treatment with a banned medication, such as asthma and ADHD medication. Inform your athletic trainer of your current meds, and they will let you know if you need one. Along with making sure you're physically healthy, we also care about your psychological and mental well-being. Some stressors that affect mental health include big life changes in new environment, homesickness, loss of family member or friend, relationship difficulties, increased pressure in school, work, or athletics, and injury or illness. When mental health declines, you may feel fatigued, sleep disturbances, feeling overwhelmed, get behind in schoolwork, procrastination, mood changes, stress and pressure, lack of concentration or motivation, poor eating habits, and it increases your likelihood of injury. If you find that you are struggling in any way, come talk to us for advice. It is completely confidential, and we're here to help. The Harbor in the new Student Center is an additional safe place to go. You can also set up an appointment with Health Services, who have skilled psychologists on staff. If you need assistance after hours, call the main line and ask to speak with an on-call counselor. Don't want to see someone on campus? That's okay. We can help with that too. Cardiac arrest is an abrupt loss of heart function. It is a serious, life-threatening emergency situation. That is why we take precautions by having you fill out a health history questionnaire and yearly physical exams. All coaches are CPR certified, and AEDs are available at all athletic facilities. If an athlete has a sickle cell trait, during intense exercise, red blood cells containing the sickle hemoglobin change shape from round to quarter moon or sickle. These cells accumulate in the bloodstream, blocking normal blood flow to the tissues and muscles. So know your sickle cell trait status and consult your trainer for precautions if you have it. Thank you for watching the Sports Medicine Compliance video. You have all read information on these topics before on your ATS profile. Please sign back in and sign the compliance verification form to verify that you watched this video. Any questions, feel free to contact your athletic trainer.